Welcome to episode 7 of The Wellness Whisperer. Today we are talking pediatric and family care with a husband and wife duo who opened a chiropractic clinic in Lenexa, Kansas called Your Family Chiropractic. The owners, Jaimie McAuliffe and Connor Thomas, met in Texas, or Iowa, I believe, and decided to move to Kansas City to be closer to family. Today, they are one of the few chiropractors niche focused on prenatal and chiropractic care for infants and adolescents. Let's dive into the conversation of why that's important and how it can help your family be whole. Tell us a little bit about how you met, where you went to school, and how you decided to move to Kansas City.
Yeah. So I'm from Southern Illinois and Connor's from Iowa. So we did not meet in our earlier years, but we both individually happened to go to Dallas, Texas for chiropractic school after undergrad. So we met down there through a mutual friend. I always said I wouldn't marry a chiropractor, but spoke too soon, I guess. So we met down there. We graduated. I was a semester ahead of Connor. We worked in separate offices. I was in a family practice. Connor was in kind of a high volume, kind of saw every dynamic of individual and family for about 2 years. And then I think it was late summer, fall of 2021. My sister was having a baby. His sister was getting married. Our families were growing. I mean, I think there was a point of like 4 to 6 months where we were on an airplane every 3-4 weeks. So we're like, we're not even 30 yet, and this is already our life. I mean, we love the go, go, go life. Don't get me wrong, but it was a lot at the time. And I was like, okay, if we're going to have kids, how are we going to get back and forth all the time? How are we going to see our family? Family means everything to us. It's what keeps us going. We have a great support system. And I'm like, we got to get home somehow. Like, we got to do this. And kind of the stars aligned, and it was time kind of in both of our careers for us to launch our own practice. So we started working on our LLC and social media and all that down in Dallas while we kind of tied up loose ends and found somewhere to live up here. And we settled on Kansas City. We both grew up coming here. My parents are actually in Lee Summit. So we had the familiarity of Kansas City. And we knew we wanted to be in Johnson County. And so it's been so great. Yeah. So we love being here. It's been coming up on, I guess it was 2 years in practice, yeah. February. So we moved end of 2021, and now here we are.
Yay! Congratulations. So the name of your practice is Your Family Chiropractic.
Yes.
Yep. And it's in Lenexa, Kansas.
Yep.
And opened in 2022.
Yes, opened in 2022. We see tons of families and kiddos and pregnant women, and it's fun.
Dads.
And dads too. I know. I see a lot of women. Connor sees men, so I guess I wasn't speaking for Connor, but
yeah. Well, I pulled up a stat that 35 million people visit chiropractors every year, and that around 2 million children visit chiropractors every year. So
wow.
That may not be accurate. That was Science-Based Medicine Journal that said the 2 million children visit chiropractors every year. But tell us why you decided to focus on prenatal, pediatric. I know you got the dads that come in there too. It's the family unit that you're taking care of, but a large percentage of your practice is children, correct?
Yes,
Yeah,
I would say.
I'll let you handle this one as well.
Yeah, I would say about 65-70% of our practice is family. So I like to say prenatal pediatric, but obviously moms aren't pregnant forever. So moms are pregnant for 9 months, and then we have baby come, or they have second, third, fourth children that come, or we see them prenatally. So I would say that 65-70% is moms and kids, any age of mom, any age of children. And we kind of got into it. We both actually wanted to be athletic sports chiropractors. I wanted to go to the NFL. Connor's a pre-high school college athlete, so wanted to see the tough, strong, do a lot of muscle work and rehab. And then I think we both kind of changed in school. We were like, you know what? The feeling of helping a family is just so much more incredibly rewarding. Not that athletes don't need our care, but like when a baby's not sleeping or a mom's having a really stressful pregnancy, like them telling you that things are better, things are different, or things have changed, just like warmed our heart so much more than kind of the athlete route. But
So what kind of athlete were you, Connor, in high school or college? What were you doing?
In high school, I was a multi-sport athlete, so I did football, basketball, track, and then in college, I played a couple years of junior college football. So, I mean, I grew up playing sports. I've always loved sports, and like Jaimie said, I thought that was kind of the route I wanted to go with chiropractic. And it's kind of funny how things change and maneuver a little bit, but yeah. So I grew up, playing all sorts of different sports.
Well, you look very healthy, and it's interesting now that just for our listeners, I met Connor in the Wellness Consortium in Kansas City, which is about 130 wellness practitioners, basically. So a very healthy, holistic minded group. But this may be stereotyping chiropractors, but since I've really, when you buy a white car, all you see is white cars. Since I've been hanging out and interviewing chiropractors, I have noticed that they're all very physically fit. I mean, I'm talking about a lot, like dozens that I've talked to in the lab, noticing they really, even more than MDs and DOs who maybe
Yeah.
get the punch belly and the post high school look. So congratulations. And I don't know if that's instilled in you in chiropractic school. Why is that? Chiropractors seem to be more fit.
I,
A little
I
bit of
think
both.
I think it's a little bit of both. And as a chiropractor, we are essentially participating in a sport type of action and motion while we're adjusting people. So you do have to take care of your body. You have to put yourself in weird positions on a daily basis. And so just taking care of yourself is a huge part of that longevity. That we want to be doing this chiropractic thing for a while. And so taking care of ourselves is certainly something that we pride ourselves on.
Being in the wellness holistic space in general, just we know that it's not just one thing that's going to make us feel good. I mean, we have to eat well. We have to, we love being outside. We work out 4 or 5 days a week. I mean, we love staying active, and we practice what we preach to our patients too. Like if they come in and there's certain things going on and we're like, okay, well, let's talk about your diet, or let's send you to a nutritionist. Like we know that there are multiple things that people need to be doing to stay healthy. And I think we just love living that healthy lifestyle. I mean, if we live an 80-20 balance, we do love happy hour and extra cheese pizza and takeout every once in a while, but I would say 80% we really try to hone in on things that are good for us and good for that longevity.
Well, I think that's something that the general public may overlook in your value that you're delivering to them is the amount of physical energy that you put in and pass through to a patient, that you're using muscles and sweating and lifting bodies and torquing and tweaking them. So that takes a physical toll on you as the provider, and people forget that.
Yeah.
So, okay. So I was surfing, and I'm not a mom, but I was trying to find out what was passing through people's mind that weren't familiar with the chiropractic industry. And these were the top 4 questions that people ask. Is it safe to take a child to see a chiropractor? So let's address that one.
100%.
Yeah. I mean, yeah, 100% it's safe. I know we say that TikTok and YouTube gives a bad rap on chiropractic. You can find anything and whatever. But the force is so gentle. I mean, we tell people it's like the pressure to check the ripeness of an avocado. I mean, there is no heavy exertion on these little bodies. I mean, think of your head and then think of their head. So, I mean, their bones are just so much smaller and their body is just so much smaller. So yes, we say it's safe. Yeah.
And this question's for Jaimie. How would a new mother, let's say that they didn't have much guidance from their generations ahead of them, how would a new mother know her infant could benefit from seeing a chiropractor?
Yeah, so we usually tell our moms to look for a few things. Some of the big ones are constipation. If your baby's not pooping at least once a day, that's a good sign to see a chiropractor, as well as favoring one side, like always looking to the right or always having a right head tilt. That could be an indication to see a chiropractor. And then as well as any latching issues. So whether that's bottle, whether that's breastfeeding, any form of feeding, if there's difficulty, if there's pain, if they're spitting out the bottle, lot of spit up, not drinking the milk as efficient as one would think. Those are probably like the three big things that I tell parents to look for.
Interesting. Yeah, I can see that if they have the lilt or whatever. Yes. And the constipation is interesting because I just went to a campground with my family and they had a little girl there that just would not go. And I fear I should have spoke up and sent them your way, but I didn't know you yet.
Yeah.
But they were taking them to a regular primary care physician, and that route immediately they start giving them, I don't know what it is, some sort of formula.
Miralax or something.
Yeah.
Yep.
So there's a natural holistic way to address these
Absolutely.
triggers or signals that a child is showing you that they need help.
For sure.
Okay. Then I also read that pediatric chiropractic care can help with bedwetting, asthma, and ear infections. Can you speak to that?
Yeah. So at the end of the day, chiropractic is not treating asthma. It's not treating constipation. It's not treating the ear infection itself. What we do is we address the dysregulation or dysfunction of the nervous system, because your nervous system literally controls every single thing, every single function, every organ in your body. People aren't aware of that. I mean, I think that kind of goes unnoticed, but the nervous system literally controls every thought, every breath that you take that you aren't aware of, your heart, your bowel movements, all of that. So addressing the nervous system itself is what we do. So in turn, you see things like pooping more frequently, sleeping better, ear infections are less, or I don't remember what the other one you said.
Bedwetting.
All those bedwetting. Yeah. So addressing certain areas of the nervous system and seeing where the stress is can really help with those symptoms that parents are noticing.
And I'm going to call Connor in. Let's talk about the dads. Okay, you got a growing family. You've got a wife that's 9 months pregnant and probably irritable, and you're trying to help her, and your exercise routine is not what it should be. How are you calling the dads in and providing them support?
Well, first and foremost, I mean, taking care of a pregnant wife certainly comes first. And, if you're not able to necessarily get your workout in, because you're helping your wife, that's 100% fine. And I'd rather you be taking care of your family at that point in time. So, really just empowering them to, yes, care for themselves when they can, but, 9 months pregnant, world's about to completely change. There are certain things that may just kind of get shoved to the wayside, and that's, at this point in time, that's okay. It's not going to be, completely life altering to miss a few workouts here and there. So just, again, empowering them to care for their family, care for their wife, and know that, in times looking forward, that they can certainly get back to some sort of a workout routine.
I love the camaraderie that you have as spouses running this family clinic, because you are providing whole family, holistic care in an ever-changing family dynamics, ever-changing world dynamics. So there's so much going on. How vocal can you be with your patients about what you're seeing in their lives and how you can help? Do you just wait for them to knock on your door and say, oh, my back's out of place? Or can you say, I've noticed you picked up a few pounds and maybe we
Oh, yeah.
How do you interact with the family as you see the changes going on in their lives?
Education is huge. I mean, education is huge. We're very present on social media. So a lot of our patients follow us there, and they'll be like, oh my gosh, I saw you posted this about latch. My baby literally had to stop breastfeeding, or whatever. And then the other thing is when they're in the office. So a lot of times, whether that's your massage therapist, your medical provider, other chiropractors, a lot of people don't do regular check-ins. So we are very, 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 very in tune with our patients and their families. So we have small talk every visit. I mean, I'm like, what's your husband do? What are you doing outside of work? What are you doing this weekend? How's everybody feeling? Like, we are checking in every time we see them. So if they're like, oh, my husband was out playing golf and he fell, so we couldn't take our family road trip, that's like our opportunity, like, hey, our opportunity of education of, why don't we get him on the schedule? Why don't we see what's going on? Check him out. Same thing for kids. We're like, yeah, my son just isn't sleeping well. And like, hey, have you thought about chiropractic? We're happy to get him in, see what's going on, and see if we can help you or send you in the right direction of someone that can. So education is huge, especially in our profession, because there's a lot of different ways to practice chiropractic. There's not one standard way. And I know people are like, there's chiropractors everywhere. There are. And I love seeing that because there's so many different approaches to it. Like we are not the same as the one now next door. We're not the same as the one that we practiced in Texas. I mean, it's just, you can really get custom treatment to kind of what you're looking for at a chiropractor.
Well, I love that you're asking those questions because I can't remember the last time I went to a primary care physician and they asked me anything about my life.
No.
What are you here for? What do you need? Do you need a script refilled? It's very just get you in and out.
Yep.
And they're not asking you. Now, I used to work for Mosaic Life Care, and that was their tagline was wellness or life care reimagined. So they trained their doctors to ask certain questions that weren't being asked by other doctors, like drinking too much, what's your physical outlet? So at least that was being threaded in there, but it's not common. So good for you for diving deep into what's going on in their lives.
Yeah.
And I do want to, if you don't mind, Brenda, I do want to piggyback off something that Jaimie kind of mentioned is we really pride ourselves on making connections with other healthcare professionals within our community. Because like Jaimie said, it's not always something that's solely chiropractic related. We love, sending our patients, if it's going to be better for them to, like she said, a nutritionist or to someone who has maybe a little bit more knowledge in like a PT realm. So asking those questions also allows us to not only care for them the best in our office, but potentially sending them somewhere that might be able to really help them as well.
Yeah, that's great to know that you're looking out for their best interest. You're not just looking to, have a patient for life, that if there's a better fit, that you're open to doing that. And that's as it should be. You mentioned massage. Does your practice offer that as a service? And if so, but both for kids and adults?
We do not. We don't do any massage here in the office. Connor does some soft tissue work, which is not
a little bit different.
A little bit different.
Similarities.
More specific area, not a full body hour-long massage. We refer out for massage. We refer out for any body work outside of chiropractic. Yeah, we're strict chiropractic in here.
And let's talk about medications. Obviously, you're there to do the neuro alignment and musculoskeletal alignment. So you're not prescribing medications. It's a holistic.
No. Correct.
And how is that? How do your patients embrace that, or is that?
Oh yeah, I think they know coming in that. Our patient base is so variety of the spectrum of holistic. We have some people way on one end, way on the other, but we serve everybody regardless of their mindset on health. We say if you have a nervous system, you have a spine, you're welcome in our office. So we don't care what your opinions or views are, but I think they know coming in that we aren't going to prescribe the medication. We do some supplements here in the office that we'll recommend to help support, or they'll say, hey, do you have something for, I don't know, I'm constipated. Do you have a probiotic or a magnesium that you recommend? Yes, but it is not prescription level. It's very over the counter and usually pretty natural.
Let's talk about patients that are like my mother, for instance. I'm trying to get her to Kansas City. She lives in rural America, very old fashioned, and oh my gosh, she's 83 and every painkiller ever. She's had steroids in the back and her hands and has rheumatoid arthritis. Is that something that you can relieve? I mean, obviously chiropractic work in part can relieve pain. How do you deal with patients with chronic pain naturally?
Yeah, to be honest, that comes down to a patient by patient basis. Everyone does have that different background. Typically people with chronic pain, it typically, if they want to see results, that I will say that typically does take maybe a little bit longer than someone who has some sort of recent or acute type of injury. I'm never going to promise that we're going to be able to get someone completely out of pain, because again, our focus here is making sure that the nervous system is functioning as best as it can, the body's functioning as best as it can. And sometimes you have flare-ups. Sometimes, it's really hard, especially when you've been dealing with something for so long, to get to 100%. But what it comes down to is really seeing what are their goals. If their goal is to be 100% pain-free, I'm not gonna sit here and promise that's gonna happen. So, it really does vary, person by person. A younger person might also respond a little bit sooner or quicker than an elderly person. So, yeah, it varies person to person, really.
Yeah. And it goes back to lifestyle intervention, which
Absolutely.
I know in my mother's case, it's like drink some more water, do a sauna, go do some infrared, and none of that's happening. So I'm sure you're advising your patients on some easy, alternatives that could
Sure.
have relief in the body beyond taking Tylenol every night or
Right.
going to bed with a glass of bourbon. Um, let's go back to, do you have any, I know it's patient confidentiality, but any outstanding results with dads or moms that you'd like to share that, was life-changing for them because of coming to your service?
Honestly, every patient that gets results just makes me so happy because everybody's measure of quality of life is so different. So if it's a mom who comes in and she's like, I finally slept 6 hours last night. I haven't slept more than 2. Like that to her is millions that I could even like that to her. To me, I'm like, okay, 6 hours sleep, sure. But that to her is so, so, so important in her quality of life. And then, or a mom who's like, my baby finally latched and it's not, my nipples aren't bleeding. Sorry, TMI, but my nipples aren't bleeding or cracked, or I'm crying as my baby's trying to breastfeed and I just want to do it. And finally it's comfortable. So honestly, like whatever the patient's quality of life becomes is huge for me. So I can't pick just one that's so outstanding because I'm so proud and so happy for the patients with any of their improvements, honestly.
But yeah, just those little shifts are a
Little
huge
steps.
difference.
They're so big. Yeah. Yeah.
Yeah. What about you, Connor? Any, with the dads, any big achievements or shifts that you've helped them make?
Certainly we've had patients in here that haven't been able to pour their coffee in the morning because, their shoulder hurts so bad that they're now able to they're get up and perform their morning routine. I've certainly helped dads, or soon to be dads, get back on the golf course. Even teenagers, making sure their body feels good when they're in the weight room. So examples like that, again, it's to some of us may seem super
Doesn't seem
small,
like a lot, but
to them, I mean, being able to pour a cup of coffee
it's
is
huge.
huge for somebody. So just even those little wins, like Jaimie said, it makes our day. It's why we do what we do.
Yeah, I was looking at your social media before we jumped on this interview, and I saw something about dude therapy. I think it was you working
Oh,
on
dads and dudes.
that.
Dads and dudes, yeah, yeah.
Dads and dudes.
Dads
Love
and dudes.
it. Love
Yeah.
it. So Jaimie, what is birth trauma and how can you help a mom and a baby if they've had birth trauma?
Yeah. So birth trauma gets thrown around a lot. Um, Lately, I think, especially in the chiropractic world. Personally, in our office, I don't like to use that word because I don't like for a mom or a family to feel that um, their choices in birth or what happened in birth was their fault. So that word is kind of like a hot commodity in the family wellness area, but it is a thing. Birth trauma definitely exists. Birth trauma is essentially during birth, during labor. It can be trauma to the mom, trauma to the baby. It can be not consenting in the hospital for a mom to get like her cervix checked and she feels violated. That can be kind of traumatic. And she holds on to like maybe an emotional response to that. Or it can be physical trauma, like say there was a really long, drawn out labor process, say 30, 40 hours, who knows, and then maybe baby's stuck, and then they have to use like forceps, and they have to use vacuum, and there's a lot of pulling and twisting, trying to get the baby out to make sure that mom and baby are healthy. So there can be some traumatic events that happen in pregnancy and birth. And how we can help with that, like I said, just looking at those cues. I mean, pulling, twisting, turning aggressively on a little baby's neck can definitely cause some neurological damage. I mean, we have so many very strong, powerful nerves in that upper cervical or that upper neck region. And when it's twisted, that affects the function of the nervous system. So then we see things like a lot of crying and difficulty latching, because those nerves go to the function of the mouth, difficulty sleeping, things like that. So
I don't know which one of you to pose this next question, but it has to do with scoliosis. My doctor missed it when I was growing up. I think I saw it in a picture in high school when my shoulders was way up. I'm like, what's going on there? But completely missed it, and it could have been corrected. So do you check the kiddos coming to you for curvature in the spine and make note of that?
Yeah, absolutely. And, one thing about scoliosis is that there's varying forms and severities of scoliosis. If I sense that a kid has scoliosis, I will certainly, let the parents know. And honestly, as long as it's not in a degree where it could be affecting, anything internally, absolutely will treat them here. I'm never, again, I say this again, I'm never going to say that I'm going to be able to get their spine completely straight. That's not necessarily the goal. The goal is to just make sure that that spine is operating as best as possible, given the curvature. So it's definitely something that we look for. It's definitely something that I've told parents may be going on. But yeah, we certainly, if I sense that there might be some extra curvature, in some direction of the spine, I will definitely bring that to attention.
And we'll refer out for an x-ray too. Yeah. I mean, if we think that there's a significant curvature, we'll say, let's go refer you for an x-ray, just double check the degree of curvature and see if there's any additional concern there.
And the next question is about our stress system. It seems like we're all stressed out over one thing or another: mass shootings, politics, kids growing up, violence. I understand there's a big word that you'll have to explain to me, but if our stress system is constantly switched on, it's called subluxation. Is that correct? Is that the term you use in chiropractic world?
Subluxation.
Thank you. Can you speak about that?
Yeah, that is also kind of a pretty hot topic.
Yeah, it's a hot topic in chiropractic.
Profession.
Yeah.
People really define that in a lot of different ways. Some people define that as kind of bones being not in proper alignment. We look more at really just more stress kind of on the body, whether that's, some sort of physical stress, mental stress, things that we're putting in our body, toxic stress.
Can cause that subluxation or disruption, dysregulation in the nervous system, leading to additional stress.
Yeah. So some type of stress on the nervous system, specifically, again, whether that's kind of physical things we're putting in our body, or even things that we may be holding on to emotionally and mentally as well.
Because that affects our nervous system. When there's stress on the nervous system, say the nerve's going to your gut, it's going to shut those off. So then we have those things like constipation and stomach aches. I mean, because we are stuck in that fight or flight, always kind of in like defense mode. So our body isn't going to function regularly, and some of these organ functions are going to slow down or shut down temporarily if that stress isn't addressed.
Okay. I've seen a chiropractor, but very, I don't know, not every week or every month. But when I needed her, she was always there. But I recently went to a massage with an acupuncturist who's part of the Wellness Consortium, and she goes, "Oh, I can tell you need an adjustment." How do you know you need an adjustment? How can we be more cognizant of that as people? What is the indicator? What is an adjustment, and how do we know we need one?
That's a great question. So there's a couple different things. As a patient, obviously, if there's something going on that you are feeling, or whether it's pain, whether it's headache, whether it's not sleeping, constipation, anything that you're feeling, maybe your indicator. Everybody's different. But also we have people that come in that don't feel anything, or our wellness patients. So they are continuing to come at a lesser frequency, not necessarily when things flare up, but they want to avoid those flare ups, whether it's a headache or irregular sleep or ear infection or what have you. So they come in kind of preventatively or proactively, and get adjusted so that their symptoms stay at bay and function stays optimal.
Mm-hmm. Okay.
Yeah.
Just having the body working at high function, just like you take your car and the tires haven't been rotated in 6 months.
Exactly.
Yeah.
That
You
type
don't
of
wait
thing.
till your tires get bald.
Exactly.
You want to maintain those tires as long as possible.
Yeah.
Okay. And this question is for Connor, because I know we're having some mic difficulty. Talk about the vagus nerve. I see it a lot on social media. Everyone's talking about it, how to stimulate the vagus nerve. I never heard about that 20 years ago. What's going on with this nerve thing? Why is it like the hot topic right now?
Yeah, so the vagus nerve is one of the longest nerves in your body. It comes from essentially your brainstem, and it runs all the way down through heart, lungs, and kind of ends up in the stomach area. So if you've ever heard of kind of like the gut-brain connection, or brain-gut connection, that's essentially what the vagus nerve is it connects your stomach to your brain. And so it has a big influence on a lot of different functions in your body. And, we talked about the different types of stress that can go on in your body, can certainly affect the vagus nerve, whether it's the food we're eating that's affecting, our stomach. And that's, everything goes from stomach up to brain. So, there are definitely ways to stimulate the vagus nerve in a positive way. One is through chiropractic care, and there are other ways outside of the office that we also can educate our patients on as far as stimulating the vagus nerve as well. Gargling, singing really loud is a really good one. Yep. Your gag reflex. Yeah. So those are all ways that you can kind of stimulate outside, but certainly with adjustments to kind of the neck region there can also be a really good stimulator for vagus nerve.
I didn't ask this, but you guys said you're in your 30s. What does an average patient look like at your clinic? Are you dealing with a lot of younger generation, millennials, or X's, or what does your average patient look like?
I'm not really sure what
we're millennials, I think. So we're the end of millennials.
Yeah.
I would say we're seeing a lot of our age. So late 20s to late 30s, I would say, is our average parent couple demographic.
Kind of in that age range of
like
new
parents,
starting families.
And 20 or 30 is the new 20 now. So people were having kids at 20 and now they're having them at 30, 35 now. So that new parent age is, I would say, our average age.
That doesn't surprise me because I follow all the literature and reports that Rupa Health puts out, and they collect diagnostic lab information for functional medicine doctors, but they did a study showing how alternative medicine, functional medicine is being more embraced, and much more by the younger generation who is more open-minded about holistic health than the older generation is, because it seems like if you're a boomer or whatever I forget the generation above boomers, you're just used to just go to your doctor, do exactly what he says or she says, and everything else is hoo-ha, which I don't believe, obviously. So I'm glad to hear that you have that support from the younger generation, because I know the founder of the Wellness Consortium, Dr. Michelle Robin, is very concerned about generational health, and that we're having, kids aren't growing up as healthy as our generation, overweight, less active.
Yep.
And hopefully your practice can head that off and make a difference in that area.
Yeah, I would say a lot of our families are very open-minded. And I think the younger generation, the millennial, what's after us? Gen Z, Gen X? I think Gen Z. I don't know. The one after us. I think there's just so many more resources now, and people are pushing back. There's more evidence, there's more options versus the boomers where you're, like you said, you went to your doctor, which is what you should do. You should trust your doctor, you should trust your provider, but you didn't really have the opportunity to ask why or negate what they said or kind of give any pushback. It wasn't really, it was kind of frowned upon at that time. I mean, I wasn't there, but that's what I've heard. And now I think people are getting more confident in their options and asking why and really digging into different forms of healthcare, and not even just healthcare, just different options for various things.
What do you want to, you spoke about education being so important. What is any myths that you want to dispel in this conversation, or anything that you would really like to leave the audience knowing about chiropractic care? If you could get on your soapbox.
I mean, the big thing is chiropractic isn't just for pain. We've mentioned it several times how our main goal is to make sure your entire body is functioning as optimally as possible. I mean, we've mentioned that, you know, especially with little ones, ear infections, you know, constipation, stomach issues, colic. So again, just getting away from only being able to help with pain to being able to help the body as a whole. Yeah.
Mm-hmm. And let's talk about the money piece. I know that unfortunately, a lot of holistic care isn't covered yet by insurance. People have to use their HMS or whatever it's called, their money they tuck away on the side. How is that how your patients are paying for to see you through?
Yeah. So we're a cash practice by choice, not because it's not covered, but we both came from insurance offices. We knew that we didn't want to fight that battle. I mean, as straightforward as possible.
Seems more of a game.
We're the provider, not the insurance provider. So I want to dictate care and give you my best recommendations. I don't want an insurance agent telling you what your health recommendations are. So it was something we chose, and then we haven't really had any pushback. I think if you're in the holistic, you're in the wellness space as a patient, you understand that your insurance is really great if you are getting your leg cut off, having some drastic surgery, fabulous. That's what it's crisis care. But as far as preventative wellness care, I mean, yeah, they cover your annual visit, every annual wellness check, but anything else preventative is not usually covered. So we just didn't want to fight that battle, and it hasn't been really a problem.
Yeah, I totally understand. So if I were to call, or anyone were to call your office, are you taking new patients, and can they pick if they want to work with Connor or pick if they want to work with Jaimie? How does
Absolutely. Yep. They can call the office. We are accepting new patients, and we can usually get them in, if not same day, definitely within 1 to 2 days. So same week for sure. Yeah.
And tell us your address and location and how to find you on social media.
Yeah. So we're at 7797 Quivira Road in Lenexa. I'll let Jaimie kind of go with the social media part there.
We are on Facebook and Instagram, definitely more active on Instagram. Your Family Chiro KC. So YOURFAMILY CHIRO KC.
And I will
And then
type
Your
that
Family,
out.
yeah. And then Your Family Chiropractic on Facebook.
Okay. And for anyone listening, you can find this episode. Today is January 25th. It'll be published live on January 26th, Friday at wellnesswhispererpodcast.com. And I will be sending links to Jaimie to put on her social media. Thank you both so much. I'm going to end with one marital question. What is it like working together in a healing industry as husband and wife?
I love it. We both love it.
Yeah.
I just had a meeting this morning and someone asked me the same thing. And I can't imagine, especially over the last few years of how the world has viewed health and wellness itself. I can't imagine not having a partner who in practice and also in life, who we have the same health and wellness values, family values. So I personally love it. And it's great that we kind of separate work and home. We don't bring the business home. We do all of our meetings, all of our work at the office, because we're not just business partners, we are husband and wife. So in the office, we are business partners, and at home, we're husband and wife and go about our day, kind of given our space just to protect that energy.
Connor, do you want to add anything to that?
I don't think there's a lot to add to that. No, she pretty much.
Okay, I lied. I asked a lot of questions. I'm going to ask Jaimie one more question. If your fourth generation chiropractic grandfather were looking down at your family practice, chiropractic care right now, what would he say?
Wow. I think he would just be so proud. Yeah.
That you're carrying on the legacy.
Yeah, it's changed so much. My great-grandfather, I didn't meet my great-grandfather. He died at a very early age, in like 30s or 40s. So, but he graduated in 1923. So we just hit 100 years of McAuliffe Chiropractic. And he was one of the founding fathers of the profession. I mean, he went to jail for practicing chiropractic when you couldn't. So I can only imagine the change 100 years later of him being like, wow, it's still there. Like it's bigger, it's better. There's more evidence. There's more people. It's not as scary or as illegal as taboo as it was. So yeah.
Wonderful. Thank you, Connor Thomas, Dr. Connor Thomas, and Dr. Jaimie McAuliffe for your interview today. I really, really appreciate it.